Morning, I'm David DeRoff. I am a family doctor and the executive director at Kōkua Kalihi Valley Health Center. It's been my home for the last 31 years, and I'm joined this morning by some of my co-workers, a group that I'm tremendously proud of the work they do day in and day out for the welfare of children in our community. And I'm so proud of the people I'm able to work with every day. And really, we're tremendously honored to have this recognition of the work we've been doing now for almost 50 years. One of the things that's really remarkable in my mind is that a year ago, when this pandemic came into our lives suddenly, we had to radically transition in 100 different ways as an organization. And I can honestly say that within about 2 weeks of the pandemic hitting, we had already spun on a dime and reorganized many of our programs and services to maximally serve the needs of our community as they arose during the course of the last year. Quickly, with the pandemic, there was this mantra of test, trace, isolate, and quarantine. And we discovered, thanks to the voices of our community who spoke up loudly, that none of those things would work if they weren't wrapped in a blanket of support. I can say my very first patient was a young woman who, when I called to tell her that she was positive and she would need to stay home for the next 2 weeks, she said, "But Dr. Duroff, I'm the only one with an income. How are we going to pay rent? How are we going to put food on the table?" And our staff, thanks to the support of so many charitable organizations in Hawaii, our staff went to work right away, delivering meals, food baskets, masks, hand sanitizer, reaching out to people on a daily basis to see how they were doing when they were isolating at home, and then moved into rental assistance, and all sorts of other forms of support for our community.
One of the things that we found, in addition to food that families were really needing, was diapers, and that wasn't something that was really being done by anyone else that we could send our patients to and say, "Oh, go here and you'll be able to get diapers." So the family strengthening folks, Sela, Myra, Sarah, they partnered with an organization to bring diapers to KKV, so that now when a family says to me, "I have no diapers," and I see these kids, they're reusing diapers and getting sick from it, I can say, no, don't, we can get you diapers, in addition to food, because food has become one of the biggest needs that I'm seeing. Like every day, at least, I would say half of the families I ask if they have enough food, they tell me no.
What inspires me really is, what is very clear when this happens is that KKV, for me, the way I see it and I saw it, is that KKV was unified into the into looking is, okay, what we can do together to be with our community and support in whatever possible way. I have the opportunity to go and deliver some foods and the youth that we serve and their families, just to see their smile and say, "Hey, Auntie Rona, hey, that's KKV, hey, that's K-Vibe." That's already an inspiration. It makes a lot. And
from my position, one of the great joys I've had and gifts that I have in working at KKV is just how much autonomy staff have to do what needs to get done. And there's so much allowance to listen, and I've just been surrounded by the most caring and knowledgeable people, and it's really been amazing to see the whole response to the pandemic. So.
What really inspired me to work with KKV and kind of join the KKV family as a lawyer was exactly that, these core values, that it is about all of us working together. It's about integrating all of these, I don't even want to call them services, all of these programs, and KKV's motto of neighbors being neighborly to neighbors, that we really treat each other as neighbors. It is all connected. So legal issues are connected to health issues. and that all of the work that we're doing is about improving people's health and well-being.
I've been here for 11 years, so what really makes me to build my trust in the community that I've been working with during the pandemic, even though we've seen a very, very difficult time for us, but yet we're still out there to help our community, to build the trust and to build the family, to make the family to feel that, oh, there's somebody that's still there for them. So I've seen that they always say that we're so thankful to KKV and all the programs at KKV for supporting us during this pandemic.